So let me to introduce the next speaker. Is Bernardo Kremer. Use of a simple proximal optimization technique to improve renal flow after endovascular treatment of type B aortic dissection.
Hallo, guten Tag, mein Name ist Bernardo, ich komme aus Palmas, Brasilien. Vielen Dank für die Einladung. So I hope my English is better than my German. So I'd like to share with you a simple proximal optimization technique called POT that have been described only before in coronary arteries. There's nothing to disclose. Here's the case. 50 years old woman with acute myocardial infarct with cardiogenic shock, and the patient requiring noradrenaline, dobutamine, and mechanical ventilatory support, very critical ill patients. After recovery, the patient has another chest pain and back pain without new change in the electrocardiogram, and the echocardiogram suggests type B aortic dissection. Here's the angiogram that confirms the diagnosis, and here you can see a type B aortic dissection. At this point, very tight in the true lumen and more than one entries, and the dissection go through the left iliac. Here's the case, the tomography. You can see a kink in the abdominal aorta, very complex anatomy. And the patient still with back pain and some leg pains after 48 hours. So because of that, we decide to treat the type B aortic dissection in this critical ill patient. So critical ill patient, recent acute myocardial infarct, recent cardiogenic shock, and symptomatic type B aortic dissection, and complex anatomy, including severe incompression and aortic kink. So we decide to treat the simple way, and a very simple way using a multilayer stent in this kind of disease. Very simple, only pull back and solve the situation very fast. And because the critical ill patient decide to use this kind of prosthesis. So multilayer stent have been used in dissection with initial experience with good results, and very low incidence of malperfusion and ischemia, and no spinal cord ischemia. So here's the procedure, very easy, pull back. We decide to put two multilayers in overlap, and the procedure, here's the final result, and the patient discharged the day before. 6 months follow-up, everything's fine. We can see the true lumen expanded, well expanded. But at 14th follow-up, we noticed that reduced contrast uptake in right kidney compared to the left kidney. As you can see here, a little bit different uptake. So decided to confirm this with a Doppler that confirms the low flow through the right kidney. And reintervention is possible with multilayer, sometimes between the stent and the vessel wall, sometimes through the mesh. But in our case, we have two mesh, two stents in overlap. You decide to use a coronary technique called POT. Here's the technique. You inflate the balloon in front of the branch, the side branch, and pull a little bit the balloon and inflate again. Because when we do this, you change the geometry and improve the flow through the side branch. So decide to do this. It's very simple. Here, no renal stenosis. Inflate the balloon, and after the procedure, again, no complication, no stenosis at the renal. After the procedure, we did again a Doppler, and we can see a robust increase of the flow to the side branch, to the renal, as you can see here. After 24 months, you keep the good results, and the perfusion of both kidneys are the same, are good. It's okay, like you can see here, the contrast uptake. So multilayer stenting type B aorta dissection, true lumen expansion, and you keep these results during 24 months. And so change anatomy in simple way, early discharge and recovery. And management of renal perfusion is very uncommon in these prostheses, but could happen. And in our case, we decide to use a POT because it's simpler and solve the problem. And this is the first reported use of POT technique in the aorta. More data, of course, is necessary to validate this procedure. Here, my team. Thank you.
Thank you. Dr. Bernardo, do you recommend to use the POT technique for every overlapping multilayer?
Yeah, probably. I don't own this case, but I can choose and can prove that work. And I think it's a good idea to use this technique.
Okay, thank you. Last one.
Okay, thank you all speakers that you have stuck to the time.